episode number 48.
When I had my near-death experiences, I didn't exit consciousness. I entered consciousness of a different form.
The last 5 days of my mom's life, we'd have Ringo jump onto the bed, and he would nestle to her, and I know she could feel him. We'd actually place her hand on his fur.
You know, you learn about cultures and you learn about people, and especially talking to the older generation, you learn about what it was like for them 60, 70 years ago, and that's just an eye-opening experience that I don't know where I would have found that if I wasn't in the milk truck.
Why didn't Yoko step in and say this isn't what he wanted?
Well, she did it.
She's the one who had him cremated.
Yeah. So, yeah.
Oh, Yoko.
Yeah, I'm not going to leave anything. I'm going to stay as vague as possible.
Okay,
so.
good. Let me know if you hear a drone over your house. Hi, this is Brant Huddleston, host of Dance Past Sunset, where we explore the best tools, tips, and technologies older adults use to enjoy peak life experiences well into and even past their sunset years. Today, I'm continuing my series on ways boomers can cut expenses and save money while continuing to live high-quality lives. We all know medical costs and insurance premiums are soaring. They take a big bite out of my budget, and I'm guessing they do yours too. That's why I caught up with a former IBM colleague, Rajesh Roa, founder and CEO of Indushealth, to tell us about how we can save thousands of dollars on medical procedures that are common to older adults. You've probably heard about medical tourism on the mainstream news, but here to tell us how it could work for you is my friend, Rajesh Roa. I'm here with Rajesh Roa with Indushealth. I got that right this time.
That's right. You did. You did, Ray.
But we met probably 10 years ago, I'm thinking. Yes?
Somewhere around there. I would have guessed maybe 7 or 8, but it could be 10. I'm
and
not
we
sure.
met right here in Raleigh over coffee somewhere.
Was it in Raleigh or in Virginia?
I think it was here.
Was it? Okay.
I think it was here. But, you know, we're getting old, so we don't remember stuff anymore. The problem is Rajesh has not aged. I'm wondering, it's the Indian food. You got to tell me your secret. You look the same.
No, it's I have aged. I think we all tend to do that as the years go by. So there's no avoiding it.
Yes, exactly right. Which is what this show is about. It's about people like yourself who help folks who need help find higher quality, lower cost ways of taking care of themselves. And that's what Indushealth does at a very high level. But why don't you tell me, Rajesh, specifically what Indushealth does?
Well, Indushealth embraces the phenomena of medical tourism in a way that provides value to employers that are looking for this in the U.S. because essentially it's driven by the need to offer good quality care at very good prices. The costs in the U.S. have gone out of control, and it has affected employers to the point where they're looking for ways to offer their employees affordable care. Because the last thing they want is to pass those costs on to the point where care gets unaffordable, and these employees remain unhealthy with whatever ailment that they have, potentially gets worse over time, and it impacts their productivity. So anything they can do to offer a way for them to get well soon, they look into. And certainly medical tourism, medical travel has become one of those features. So Indushealth has become a medical travel administrator for employers in the U.S., and these are self-insured employers, so they are essentially paying for the cost of their employees' care. And they benefit from offering this and allowing employees the choice of either going to the local hospital or going through us to one of our hospitals overseas.
So for the folks who are listening out there, how would they know if their employer is a self-insured employer? What's the profile of the type of company that's likely to be self-insured and therefore would be likely to be interested in getting high quality, low cost care outside of the U.S.?
From an employee standpoint, sometimes it's hard to distinguish if your employer is self-funded or not. But in most cases, once an employer reaches about 500 employees in size, once a company reaches that size, they are incented to switch over to being self-funded because it's too expensive to buy insurance at that point.
I
so
see.
they essentially become their own insurance provider.
Right. Okay.
And they'll often administer it through one of the insurance companies. So you'll get the same kind of card. Everything will look and behave the same.
But the money is held by the company.
That's right. That's
okay.
correct.
And I'm an employee. Okay. My company I learned my company is self-insured. And when they lower the cost of care, surgeries, medical care, dental care, all these things that I can get outside the U.S. for pennies on the dollar, how does that translate into value for me as an employer? Does it mean I get to keep more in my paycheck? Does it mean the company is more likely to be solvent and therefore I can more likely to have a job? How does it translate the value to the employee?
So there's two ways to measure that. One is getting you back to health and productivity. So clearly, if you are compromised because you have held off on attending to some kind of problem, like let's say, for example, you have a bad knee. It's been hurting you, but you haven't it's not gotten bad enough to the point where you say, I'm ready to spend the $3,000 or $4,000 out of pocket to get it fixed. Because as you know, with most health plans now, there's some amount that has to get paid out of pocket until you hit the deductibles.
Yeah. Okay.
You have a copay, and basically the copays and the out-of-pocket costs add up to somewhere in the neighborhood of, say, $4,000, let's say, for a knee replacement. And if that becomes unaffordable, you're holding off on that for as long as you can, but you're still not healed, and the problem isn't getting any better. So what the employers do is offer a way to, when they employ our option, they just allow the patient, their employee or dependent, to use our program, get care abroad, and because it costs them so much less, they're able to waive the copays. So it costs literally nothing
to
the patient out of pocket.
That if I was going to pay $3,000 or $4,000 or $5,000 as a copay to get, say, a knee replacement in the U.S., but now I learn my employer is open to medical tourism, that I can put that $5,000 in my own pocket?
Exactly right.
Damn.
And even beyond that, because many employers also...
Now we're talking real money here. Thousands of dollars that I don't have to pay in a copay that I get to keep as an employee.
Exactly. And as I was saying, it goes beyond that because most employers are also seeing that it makes sense for them to share some of the savings with the employees. So in addition to having saved the out-of-pocket costs, you also get an incentive check on top of it. Because, again, why do you do that? I mean, why do you have to incentivize someone? Mainly because you're you're kind of making them go through hoops, so to speak.
A little bit extra work because they have to get on an airplane. They have to leave their comfort zone. They have to fly to a foreign country, and a lot of Americans are probably, you and I, we've traveled all over the world, so we know that people are people everywhere. They're great people, and there's absolutely fabulous medical care outside of the U.S. Right now, my wife is getting great medical care down in Brazil because she prefers it, But for most Americans, they may say, I don't even know where that country is, much less I want to go there to get a knee replacement. What do you tell those people to mitigate their fears?
It's not what we tell them, it's what they hear from their peers. So really what's driven interest in our program is the fact that there's been a few that in each location, in each group we work with, that start the trend. And beyond that, it's just the experience of those early adopters begins to get shared in their communities, in their workplaces. And before long, everybody wants to take a serious look at this, even though they've never traveled before. Most of them don't have passports. But they do get interested hearing from their peers. They've had this wonderful experience. They've had great care and attention. Everything got paid for just like it was supposed to. no hidden costs, and you get to take a companion with you for emotional, physical support. So, I mean, it doesn't get any better. It's really about
fantastic.
you and the care you need,
Yeah.
not what someone forces you to do. It's really extending that choice to you. So when they recognize that and they experience the overall delivery of care as well as the excellent medical outcomes, it's a no-brainer. It just starts to spread.
Love it. Do you happen to know who Derek Sivers, who started CD Baby, is? Does that name sound familiar to you?
No, I don't recognize that.
He did a TED Talk where he shows a video of a pioneer. They're at a concert, and this nobody's dancing except for one guy. One guy gets up and starts dancing to the music, and then a second guy joins him. This is this peer concept where they, and then as soon as the second guy joins, then more and more people pile on. I'll put a link in the show notes. You'll get a kick out of it, but same concept, which is you hear from your friends, you see them doing it. Once you see the pioneer and maybe one or two others, you say, okay, it's all right for me now. I can join, it creates comfort for them to do
exactly.
that,
And also, the employers do a lot of due diligence before starting these programs with us. So there's also the comfort that, someone that's looking out for you has looked at it as well. So, and for us, the formula is simple. I mean, we work with providers that know what they're doing. They do an outstanding job. They don't do anything they're not supposed to because they know that could hurt their reputation. I mean, if they give bad advice or take shortcuts or anything, that hurts reputations really fast. So the fact that they take such good care to deliver these excellent results goes a long way in creating that, building and maintaining a reputation that our program is second to none.
Now, if I'm an employee, I'm listening to this show, I'm thinking, hey, I want to put that, $4,000 or $5,000 in my pocket and get a check back for the savings. How do I initiate a conversation with my employer to get them to pick up the phone and call IndusHealth and get the kind of help that you provide so that they can put these programs in place? What's the process?
The first step would be to contact someone in the HR departments. Usually it's the benefits team that manages these sorts of programs. And what we do is work with the benefits managers to help explore if where this fits for them and how much cost savings they can expect with a program like ours. So we help with that process. Many times the companies may have a benefits consultant they're working with, so usually bring them into the loop as well in terms of identifying how to structure the plan that makes it work. In almost all cases, these would get offered as an addition to other plans that you already have, not as a replacement. So you're not giving up anything to get this benefit.
Does that mean I still have the option of staying in the U.S. and using the hospital I know is in my backyard and
Absolutely.
I know the doctor?
Absolutely.
Or I could perhaps be like the guy that gets up and dances, do something adventurous and have some money in my pocket.
Exactly.
I have a choice.
You do have a choice. We maintain that choice.
That's important.
There are also some cases where patients aren't suitable to travel. I mean, they may have had some health history that makes them not so good candidates to travel after surgery. And they may require some kind of specialized follow-up. So in those cases, we don't advise them to go abroad for care.
What kind of medical procedures do you see very successfully done outside of the U.S.? You mentioned knee replacement, so I'm guessing any kind of joint replacement is one. What else do you see?
Joint replacement, joint repair, arthroscopic procedures that even repair joints are also popular. So I would say orthopedics is the most commonly used class of procedures, anything to do with joints. And secondly, bariatric and weight loss surgeries. I mean, these have become, extremely popular, mainly because, we work with providers that really know what they're doing and provide really good outcomes. And we provide them a full suite of services, a basket of services around that in terms of managing expectations, making sure there's the right kind of support for them to make the transition to a lifestyle that involves a new type of diet and everything else. So we that's the second. The third, I would say, is neurosurgeries, back surgeries. So that's sort of class of procedures, back and neck. And we also have women's health procedures, hysterectomies, and related surgeries that have also become quite popular.
Okay. Now, what about recovery? So I go outside the U.S. I have a joint replacement that could take weeks of physical therapy and recovery. How do I need to stay there and get the PT there, or do I come back to the U.S.? How does that work?
It's usually a combination. We do require patients to stay for a sufficient length of time, usually anywhere between 5 to 7 days after surgery, in some cases longer. But in order to get enough, healed enough, and also enough physical therapy to get back on that plane and make the journey back home safely. In that process, they're getting a lot of attention. They're getting daily nurse visits. Someone's monitoring them very carefully throughout that period, and that yields really good results, because when they're back home, they are usually farther along than someone that's had the same kind of surgery at a local hospital, mainly because no one's really managing that process that closely after they get back home from surgery, in the case of a local hospital. So the fact that they've been monitored and managed a lot better in that initial period really goes a long way. So they do come back home, and then they would, once they've returned from their trip, they will continue with their local physiotherapist if they need other forms of
how does the local medical profession react to having a patient walk in who says, I just got this knee replaced down in Central America, for example, and now I need physical therapy from you? It's kind of like bringing your car to a mechanic and saying, I put this part in myself, or I had Billy Bob do it, and now I want you to make sure it runs properly. And a lot of mechanics will say, forget it. How does the local medical profession react to work that's been done outside the U.S.?
Well, I think that's an interesting analogy, but this is not like doing surgery on yourself. So it's probably like saying I had the mechanic down the street do it. He didn't do a good job.
Yeah, that was probably not a good analogy. Let me ask you.
But I mean, I understand your point, and it's really varied responses we get from primary care physicians versus specialists. Most primary care physicians that see patients having lived with the problem for a long time recognize that the reason is primarily cost. So they are supportive of any means the patient has
even
at their disposal.
Even if it means taking bread off their table, it's like, oh, I didn't get that surgery.
For primary care, it really doesn't matter. Most of them, it doesn't matter where you've had the surgery. They're going to have the same continuity of care with that professional. For specialists, there is a difference, though. So if you're talking about, going back to the the local orthopedic surgeon after
who would have done the surgery if you hadn't gone elsewhere,
there you may face resistance or unpleasantness even. I mean, people may say, don't come to me. I mean, you had the surgery somewhere else. Go back there.
And that would make sense, kind of. But the primary care physician is primary care, not a specialist. So it's in his or her interest to just make sure you get good primary care, follow-up, physical therapy. Okay, that makes sense.
And for most things that we send patients for, they don't require a specialist follow-up when they get back. I mean, I would say that this, if there were some special need, we would make sure before the patient went that they had the right follow-up. But in majority of cases, patients are going for one thing. They're going to have a chance to see their physician multiple times during their visit and have the final follow-up with that physician before they get back home. So there's no real need to schedule a follow-up with a specialist, and that kind of addresses that issue for the most part.
So the employee has a choice. Let's assume that their employer does offer the program, and they have the employee now has a choice. I can either get my surgery done here in the U.S., or I can save a lot of money and have it done outside the U.S. How do you make that decision? What are some of the tools and resources that will help people decide whether they want to go outside the U.S. or whether they want to stay here. It can't all be just about the money. It's got to be other factors as well. What are those factors, and how do people decide?
Well, when you make a decision about something this personal, you want to make sure you're comfortable with it going into it. There may be some skepticism when you start out. The basic question would be, why is it so much less? Why do I have to, and do I leave something on the table?
Well, why is it so much less?
The reality is that the costs of the surgery have little to do with the price differential. It's more of how much the hospitals charge, how much the components that the implants that you're getting cost. Everything is artificially inflated in the U.S. So we have costs in the U.S. that are hyperinflated, and that causes our overall cost to be much higher, probably anywhere between 2, 3, 4 times higher than the same procedure would cost abroad. So we can layer on and bundle in the cost of the airfare, the travel, the meals, including a companion, getting your passports, all that. You can bundle all that in and still have saved a good amount of money. So the dilemma is that you're getting the same component, literally made by the same U.S. manufacturer in many cases. So it's not like you're getting a second-rate component. You're getting the same protocol of care, treatment, and recovery is pretty much the same thing you would expect.
Well,
in
in
the
some
US.
cases, these doctors are trained in the U.S., yes, or they might even be U.S. They might be Americans themselves.
That's right. That's right. Depending on where you go, there's different levels of expertise. But obviously, all these doctors that we use are very skilled and, in fact, risen to the top of their professions, and have engaged in this form of private practice where they can treat patients coming from abroad. So we do tend to limit and restrict ourselves to the best of the best because we don't want to take chances with people that may not have the right interests of the patients at heart. So we want to make sure that these are reputable doctors and they're going to continue to want to do the best for their patients.
And the way you're using we in that case is you mean IndusHealth.
That's right.
Okay, so you do some qualification of the hospitals that you work with, and who are those hospitals and where are they located?
Our hospitals that we work with are located primarily in Costa Rica, in Cayman Islands, and in Cancun. So these are places where they have great hospitals, Joint Commission accredited hospitals.
And not a bad place to recover for a couple, 5-7 days.
That's right.
I think they all have beaches, yes?
They all have beaches. And
nice beaches.
And palm trees and all that good stuff.
White sand, Mai Tais. I think Mai Tais help a lot with physical therapy. I really do believe that.
Well, we have to sometimes keep patients on the straight and narrow for their own good. So we do the best we can there. But yeah, I mean, they're really good. And there is something to be said for a healing environment because it's better than being, sent back to your home and said, with a discharge summary saying, follow these instructions, because many times these patients don't have a very good environment at home for recovery, or they may get back into their routines, which are also not good for recovery. So,
well, I don't know the Cayman Islands or Cancun too well. I've been to the Yucatan Peninsula. I have not been to Costa Rica, but I hear a lot of good things about Costa Rica. How does the culture actually seep into the medical care, or is the hospital impervious to culture? And I'm asking because I'm generally positive about foreign cultures. They tend to be very the people that I experience when I do travel are so caring, and a lot of times they're also very conscientious about holistic health and natural foods and organic and things that I think are terribly important to one's overall health. Do you see that in these hospitals, the 3 that you mentioned? How does the culture seep into the care that you get when I go to, say, a hospital in Costa Rica? Is it different than the U.S.? How is it different?
I would say it's decidedly different because when hospitals engage in medical tourism where they say they'll accept patients from other places, they have to put in the resources to make sure that they provide a different class of hospitality service. I mean, they have to differentiate that these are not the same as local patients where you may have a different sort of a relationship and expectation even. With medical travelers, you have to take into account they're coming from someone else, they don't know the culture, and they're in some sort of pain. I mean, in many cases, and may not be for weight loss surgeries, but at the same time, they have some discomfort, some anxiety.
Something
even
drove them to get the surgery. Yeah.
Right. And as I was saying, the anxiety level. I mean, just feeling like I'm in a different place and I'm going to go through surgery. What can what's going to happen? So putting them at ease when they get there and making sure they feel comfortable in that environment is just so important. They all recognize that, and to the extent we work with providers at these destinations that really know how to manage that and put the patient at ease. And clearly, language can't be a barrier. So for English-speaking patients, we have to make sure there's always someone around that can speak English and communicate well.
So in closing, walk me through a typical scenario where let's use me for an example. I have finally decided my knee pain is more than I can bear. I really want to get a replacement part. That's what my doctors recommended. And by the way, let's start even before that. I mean, how do I know? I mean, I'm suffering from knee pain. What's the process? What's the scenario that leads me through to getting surgery in the Cayman Islands or Cancun?
In most cases, a patient already knows that they have the need to have a surgery.
Well,
you
have pain, but normally wouldn't you go see a local doctor who then recommends that you see a specialist, and at that point you're in with an orthopedic surgeon who wants your business.
So in our typical profile of patient, the patient has already had that encounter with the local orthopedic surgeon. So they've gotten to the point where they recognize, yes, they need a replacement because they've tried to resolve it every other way they can, maybe, and they don't know at some point whether they need a replacement, if it's something else causing them the pain. But let's say they've had the X-ray or the MRI, they have kind of gone to the local surgeon and they've been advised that they need a replacement.
Right. And the local surgeon is one that wants the business. And he's going to say, we can schedule you for this. And at that point, you say, well, let me investigate all my options, or how do you respond to your local orthopedic surgeon who's done the work diagnosing that you need a replacement part?
Well, local surgeon will be happy to schedule you whenever you're ready. I think for most patients, it's a question of when they want to do it. This is a class of surgeries called elective procedures. They're not acute where you have to get it resolved right away or you can't go to work the next day. So with elective surgeries, you can choose to put it off for a year. It's really your choice. It's when you have the willingness and the financial resources to get the problem resolved. So in a sense, they leave that to you. They say, there's the diagnosis. You need a new knee. And when you're ready for it, we'll schedule you. We'll take care of you.
And at that point, you could go to the insurance company and say, I have this opportunity to have elective surgery done. How much is it going to be out of pocket? Or that from your insurance plan, and your insurance plan says, well, your copay is $3,000. So okay, I'm going to have to stroke a check for $3,000 to get this done with this U.S.-based orthopedic surgery. Now, so at that point, I know what needs to be done, and I know how much it's going to cost me, yes?
Yeah, and this day and age, I think there are tools available online that help you estimate your costs and things like that. Many times the hospital will also tell you have to pay your portion up front because they're not going to wait for after the surgery to collect their piece of it. So, and all these things further complicate matters because you learn at some point during that process you have to come up with $4,000 or $5,000 to pay your portion of it. So that's the stage at which you say, what are my other options? And you may have heard about our program. You may have it in the back of your mind. Someone may tell you about it over the course of time. And that inspires people to contact us and say, well, am I a candidate for this sort of thing? What does it involve? I've heard about it from someone else. I mean, if they're close to somebody else, they may have heard wonderful stories about it. So there are different ways where you find out and it causes you to engage with us. But once you've engaged with us, we go through the process of obtaining those records from you, submitting it for a consult.
Now, does the employee engage directly with Indushealth?
Yes.
They do?
Yeah.
Okay.
Because they learned that it's available through their employer's health plan.
And I'm thinking that the employer is probably promoting this internally. They're probably saying, this is an option that's available to you as a benefit of working for our company. You can get care for less. And, oh, by the way, we share some of the savings with you.
Right.
So they're marketing it internally. And people know that. Then at that point, they say, okay, I know I have this other option. I know it's through Indushealth. And I can pick up the phone and dial your number. And then, all right, take me from there.
And in addition to that, employers also hand out these summary plans every year which contain all the different plan options. So in that summary plan description, you will have information about the different choices available to you, your copays and your expectations, and also how to reach us. So, all these resources are available at their disposal to figure out how to reach us. And then once they reach us, we take them through the process of, again, an evaluation essentially to see if they are good candidates for getting this done abroad. And once they get a consult response from the doctor, they have the opportunity to talk to the doctors. We encourage that, so that they get a sense of who these specialists
are. Is that like a video call or
in most cases it's a phone call. It can be arranged as a video call, but most people don't want that or don't need that, so they're happy to just.
And most of these doctors speak English, I assume.
That's right, they do. They all do. And I think the time and attention that those doctors provide on those calls are very compelling, because you really understand that they've taken time to review your details. They understand who you are.
I hear this a lot from my Brazilian wife. She's always telling me, I don't like how I get the bum's rush when I go to a U.S. doctor. When she goes to Brazil, they take so much more time with her. And she really, really likes that.
Right. And patients, I think, feel that difference instantly. I mean, so even before they see them, right, get to see them. So in talking to them, they recognize that these doctors are very qualified. They know what they're talking about, and come across in a way that says, if you're ready for it, when you're ready, come to us. So there's no high pressure sales. There's nothing that we don't, use language like we'll do better than the option you have, at your local hospital. We don't. We give them the choice and let them make an informed decision. Many of them may want to learn more about the doctor, the hospital, the destination. Some of them take us as face value because they've heard from someone else that had a great experience at one of those hospitals. So to a large degree, it varies. The actual interactions vary. But once the patient has everything they need and say, okay, I'd like to pursue this, it's a matter of getting them set up. We check to make sure that they're eligible to, on their plan, they're current, they're up to date with their insurance and everything else, and get them going.
They schedule it. Okay, I'm in pain. I'm a little nervous about this. Maybe I've never even traveled outside the U.S. Who is there to hold my hand along the way?
So we have nurse case managers that really are key to what we do in terms of developing and building a relationship with the patients and becoming a patient advocate. So that goes a long way in terms of assuring the patient that we have their best interest at heart, because they're talking to one person that understands their need. And then we also have others that can help guide them at various touch points through different things. So we make arrangements for them to, as I said, to get their passports and explain to them how everything works from start to finish, because many of them have never been to an airport, so they don't even know what to expect when they get to an airport, how to check in and things like that. So, getting them to understand what they have to go through. They don't have to buy their own tickets. We basically get everything lined up for them. So all they do is show up at the airport, get escorted when they reach the other end to their hotel, or in some cases the hospital directly. And everything is managed for them. They have resources, by their side throughout the process that explain things and manage things. And make sure they come back with a very good outcome.
Now, for patients who live close to family, say sons and daughters who are within driving distance, there is an advantage, of course, that if they go to a local hospital here in the U.S., that those sons and daughters can come by and visit a post-op visit and drop in a couple, 4 or 5 times during the recovery period, and bring them flowers and comfort and all that kind of stuff. Now, that is not as easily done if you're down south of the border. How does medical tourism mitigate that drawback, or is it a drawback? How would you address that concern?
I think
there is the advantage that they can go visit in Cancun, which is not a bad place.
It doesn't happen often. The reality is that there are very few. They're few and far between where a relative will pay out of pocket to go and be at their side. What we do offer is for each patient to take a companion with them, and that's completely paid for as well. But then that companion tends to be there are certain criteria. We don't want this companion to feel like they're just like a regular tourist. They can go off and be away most of the time. They have to be by the patient's side and kind of provide support throughout the process. So that substitutes for what you were talking about, having people just flow through and help out. The second is, I would say for most of these folks, they are so keen on a good outcome and recovering well and just getting back. They don't miss anything. I mean, there are a few that report like getting homesick just because, they're missing family back home. But, and those are again for extended stays, people that stay 12 to 15 days, maybe for a bilateral hip surgery or something like that. But for most of the short stay surgeries, 6 to 9 days, most of them do just fine with the level of support. And the providers there become like an extension of their family. I must say that that's a consistent theme we hear from patients saying, you've done such a good job of identifying places where the providers really become our substitute family while we're there. And they've developed really good relationships with those team members and keep in touch with them even after they get back home.
All right, so last question. I sat on a plane a couple of years ago next to an orthopedic surgeon, and I didn't mean to take advantage of his, well, yes, I did, actually. So I told him about how I get this pain in my hip. He said, "Oh, you're definitely going to need a hip replacement." So I know I probably have that in my future. Can I get a discount? That look on your face tells me no.
You get a huge discount because the moment you step out of the country, it's heavily discounted from what you would pay in the U.S. So absolutely you would get
Rajesh, a pleasure. Thank you so much for telling us about what IndusHealth does, and where can they find you?
Well, thank you so much, Brent. It's been a pleasure. It's been nice to reconnect with you, and I'm happy to answer any other questions that come along. They can find us at www.indushealth.com and
awesome.
Take it from there.
A pleasure. Many thanks to Rajesh for coming on the show and giving me a tip for how to handle my hip when the day comes. A tip on the hip. That was all those fancy disco moves in the 70s. I'm telling you, there is a price to pay. Coming up next on the show is a former Playboy bunny who bounced across the big pond and is now living in Portugal at 1/3 the cost of living in the U.S. If you're interested in saving money while taking an adventure, then you won't want to miss her story. So jump on over to dancepastsunset.com to sign up for my newsletter, which lets you know about new shows and other best practices for peak living as an older adult. You'll also find me on Facebook. Just search on the 3 magic words, Dance Past Sunset. That's it for now, my rabbits and hares. Remember to make the most of every moment you have, because it's the only moment you've got. Until next time, this is your host, Brant Huddleston, signing off.
Space.